Primary care dermoscopy involves data gathering and decision making, much like a detective. This 81-year-old gentleman had noticed a slowly enlarging red scaly patch on his right temple over the previous 12 months. Gather data from the dermoscopy, decide your diagnoses, and what would you do? I noticed what looked like a small seborrheic keratosis, below which was a flat-to-touch red scaly patch. With his general ultraviolet light damaged skin, I thought, oh, it's going to be actinic keratosis, or maybe even Bowen's. The dermoscopy surprised me, and I came up with 3 separate diagnoses. Did you? We have 2 seborrheic keratoses. They have that typical yellow-brown colour with a clear, well-demarcated edge, and even some milia flashing up on non-polarized light. Perhaps there's 2 smaller ones developing here, or they could be small solar lentigos. Note the general background of actinic keratosis changes, with some white adnexal skin openings on an erythematous background caused by dilated dermal blood vessels. But centrally, what do we have here? Some well-focused arborizing vessels on a pink homogeneous background, with a few erosions scattered around the edge, and even small shiny white structures showing up on polarized light. This looks exactly like a BCC, I said. Is it a nodular or superficial type? In other words, does it need to be cut out, or can I treat it with cream? I could see no other nodular elements, and it was flat to touch. And after a discussion with the patient, we agreed to treat it with cream. Now, what would you treat him with? Bifluorouracil or imiquimod? Now, if you've watched my video, then imiquimod is the one to use for a superficial BCC, 5 times a week. And here's my review of him 3 weeks later. There's a nice inflammatory response starting. And on dermoscopy, already the arborizing vessels have disappeared, revealing a nice strawberry pattern of actinic keratosis. Here's the final outcome 2 months later. Another case cracked by piecing the clues together, the miscreant convicted, and a victim happy with the outcome of my prosecution. I rest my case.